Hello, this is Jelly again, and on this video, I am going to demonstrate to you urinary catheterization. Catheterization of the bladder involves introducing a rubber or plastic tube in the bladder through the urethra. The catheter provides a continuous urine flow for patients who are unable to control micturition or those with obstruction. This process also provides a means of assessing the hourly urine output for patients that are hemodynamically unstable. There are 8 purposes of this procedure. First is to relieve discomfort due to bladder distension or to provide a gradual decompression of a distended bladder. Second is to assess the amount of a residual urine if the bladder empties incompletely. Third is to obtain a urine specimen. Fourth is to empty the bladder prior to surgeries. Next is to facilitate an accurate measurement of urine output for critically ill patients whose urine output must be monitored hourly. Also, this procedure provides for intermittent or continuous bladder drainage and irrigation. In addition to that, catheterization also prevents the urine from contacting an incision after the perineal surgery. And lastly, it is used to manage incontinence when all other measures have failed.
The materials that we need in this procedure are as follows: Sterile Catheterization Kit or Drapes containing the following items: 1 fenestrated drape, 2 sterile small square sheets, 2 Kelly forceps, kidney basin, small bowl, pre-filled 5cc disposable syringe, and lubricating jelly. Double lumen or triple lumen catheter with a balloon tip for inflation, sterile gloves of appropriate size, sterile cotton balls, antiseptic cleansing solution, sterile urinary bag with multi-purpose tube holder or tape, sterile water to inflate the balloon, sterile urine specimen container, blanket or top sheet, hypoallergenic plaster, and pickup forceps with a jar.
Assessment. In the assessment phase, first, we have to assess the most appropriate method of catheterization. We can use a straight catheter if a spot urine sample or specimen is only needed or a temporary decompression of the bladder is required. Meanwhile, we can use an indwelling or retention catheter if the bladder has to remain empty or there is a continuous measurement or collection of urine required. The indwelling or retention catheter is made to remain in the bladder for a longer period of time. The next thing to do under the assessment is to assess our patient's cognitive level. This is to determine if the patient will be able to follow your instruction. You can ask questions such as, what date is it today? Which town did the patient come from? Next is we have to assess for presence of condition that may impair the patient's ability to assume the required position. This will allow us to plan for additional assistance. Still part of our assessment is to assess for the presence and degree of bladder distension. This is to establish a baseline for our assessment. In assessing the bladder distension, we have to use palpation technique. Remember, in our previous video, we have mentioned the 2 different kinds of palpation, the deep and light palpation. After assessing the presence and degree of bladder distension, we have to assess the time of last voiding and last catheterization. This way, we will be able to gain information that would be significant to determining the amount of urine that we will be obtaining in the catheterization process. Then, we have to assess the general body size of our patient and as well as the size of the urinary meatus. This is very important because we may have to choose a certain size of the catheter that would match our patient's body. And in most cases, the bigger the patient's body is and the urinary meatus, the larger the catheter that we have to use. Next, we have to determine if the patient has an allergy to betadine or to latex. How to do this? Of course, we have to ask the patient if the patient had a previous or prior catheterization before, or if the patient has experienced itchiness, skin burning, redness during the process and when using a latex kind of gloves. So we could determine any alternatives to such materials. So the most common alternative for iodine povidone is the Zephyrin chloride. The last part of our assessment is to determine whether we would need an additional lighting. The reason for this is because the female urinary meatus could sometimes be difficult to visualize. The supplemental lighting would greatly help. Let's proceed to planning. In the planning phase, we have to note that if we are using a catheterization kit, read the label carefully. That way, we can be guided when inserting or applying the catheter. Then, still part of the planning is to assemble all the equipment that we need in order to save time and effort. Having all your equipment and materials prepared in advance will facilitate the accomplishment of the task. Let's dive into implementation. First, we have to wash our hands and observe the proper control for infection. This is to prevent contamination and infection. Verify the doctor's order. Verifying the doctor's order for urinary catheterization is so important for legality purposes and to know if the doctor has an additional instruction about the catheterization. The next thing to do is to identify our patient, explain to the patient what we will be doing, why it is necessary, and of course how the patient can cooperate. Good morning, Miss Angelina. My name is Jelly Franklin, and I'll be your nurse for today. May I know your complete name and your birth date? So your name is Angelina Jolie, and you were born on December 13, 1993. May I check your wristband? Okay. Alright, thank you. Your doctor has ordered to give you a urinary catheterization. That is to help you feel better because of the distended bladder that you have, and so we could decompress the urine that's trapped in your bladder. Now, this procedure will be a little bit uncomfortable, but deep breathing will greatly help us to alleviate the pain or alleviate the discomfort later on. Do you have any question, Miss Angelina? After we have identified the patient and explaining the procedure, the next step will follow. Now, identifying the patient is very important, so we will know that we are doing the procedure to the correct patient. And also, explaining the procedure is so helpful in alleviating the anxiety that the patient would feel during the procedure. The next thing to do after that is to provide privacy. That's by drawing the curtains around the room or closing the door to the room. That is also an effective way of making the patient feel safe, secure, and not anxious or less anxious. The next step to follow is to place the patient in a supine position. This position will allow us to better see the meatus of our patient and to allow us for easy access. The meatus is sometimes difficult to visualize because it may resemble the skin fold of the female client. For our female client, we have to put our client in a dorsal recumbent position where knees would be flexed, supine position, and feet flat on the bed. Now, if the patient is unable to follow directions or instructions, we may need help so we could protect our sterile field. Miss Angelina, I need you to flex your knees like that. Okay, very good. And feet flat on the bed. Meanwhile, for our male client, we have to place our client in the same position. That's supine position with legs straight and slightly apart. That way, it will allow us to see the urinary meatus. So we have to take note that if you are left-handed, you have to stand on the left side of the patient, and if you are right-handed, you have to stand on the right side of the patient. That will allow us to access the urinary meatus properly and better, and also for easy maneuver during the procedure. The next thing to do is to place the waterproof pad. Placing the waterproof pad will avoid soiling the linens later on. Miss Angelina, I'm going to place the waterproof pad underneath you, okay? Alright, here we go. Now that we have placed our waterproof pad, the next thing to do is to drape our patient. Now, the draping technique, as we previously mentioned in our video, the technique that we will be using here is the diamond technique, which will allow the most privacy, and also the client could rest on the blanket. So in the diamond technique, we have to put one point of the diamond towards the head of our patient. And then grab one point, wrap it around the patient's leg, and tuck it under the patient's foot. Repeat on the other side. Then fold the lower center point of the diamond to expose the perineum area. This draping technique will allow the most privacy as previously mentioned, and also the patient will prevent from chilling during the procedure. The client can rest her legs onto blanket, while for our male client, we can drape the male client's chest all the way down and fold, exposing only the groin area. This draping technique will also preserve our client's modesty, make the patient feel secure, and will allow us to visually see the urinary meatus. After the draping process is done, the next thing to follow is the perineal care. Since we already have done the perineal care, you may refer to the video previously. I will link it here down below for your access. Then we have to organize our work area. We have to arrange our bedside table, position the plastic bag or the trash bin, and as well as position our procedure light. Positioning our plastic bag right here or trash bin will allow us to protect our sterile field, so we won't have to reach over and contaminate our sterile field. The light is very important in visualizing the meatus later on. If you're using a collection bag, we have to open the bag and place the end of the tubing within reach. Next is to open the Sterile Catheter Kit and place it on the bedside table. Make sure that you are not contaminating the inside since it is a sterile area. The next thing to do is to open our Sterile Catheter Kit, making sure that we are only touching the fold or the outside to protect the sterility of the center sterile field. Now that our sterile catheterization kit is open, we can now get the drapes and tucking it under the patient's buttocks and of course over the patient's abdomen, plus the fenestrated drape later on. So when taking things in the sterile catheterization kit, we have to make sure that we are only touching the sides. That way we can protect the sterility of our field. Then, the next thing to do is to open our urinary catheter package and drop it on our sterile field. Then we can arrange the additional materials that we will be needing, taking care of our sterile field not to contaminate it. We may now open our cotton balls and observing the sterile technique of opening it, allow it to drop over the container that we have in our sterile field. Remember, we need to protect the sterility of our field. Starting from the point away from you, and tuck it under. And do the same thing right here. Let the cotton to fall or next is to apply betadine solution. So just let it drop and not too close to avoid contaminating the area. Then, next step is to don gloves. Donning gloves is important to protect our patient from being contaminated or from unnecessary infection, and also that way we could touch things that are inside our sterile field. Now that we have our gloves on, we may now touch things that are inside our sterile field and the one that's inside the catheter kit. So then we can drop the lubricant jelly on the sterile field and place the fenestrated drape over the labia of our patient. For male patient, we have to drop it over the patient's groin area, exposing the penis or the urinary meatus of our patient. Next step is to test our catheter kit to check if it's free from any defects. Using our pre-filled syringe, 5 ml of sterile water, now the catheter's capacity for water is from 5 to 15 ml of water. So if we inject slowly the sterile water, it should not disrupt the balloon. Otherwise, it must be defective and we have to replace it. Alright, so now that we have verified that the catheter is free from any defects, we can withdraw back the water that we have injected inside the balloon. And then place it right here. Place it back on our sterile field. The next procedure is to lubricate the tip of our catheter. For female, we have to lubricate it between 1 to 2 inches, while for male, we have to lubricate it from 6 to 7 inches generously. This is to prevent mechanical injury to our patient and to avoid damaging the mucosa of our client. Now remember that if urine specimen is required, we have to remove the specimen container and uncap it. Place it near the patient for later collection, and let's do it. The next step to follow is to cleanse the urinary meatus of our patient. We have to use our forceps, our cotton ball with the betadine solution. We have to remember to discard the used cotton and not to cross them over our sterile field to prevent it from contamination. For women, we have to use our non-dominant hand, particularly our forefinger and our thumb, to hold the labia anteriorly, pulling it backward to expose the urinary meatus. Remember, we have to hold this position all throughout. And our non-dominant hand, once it touches our patient's skin, is already contaminated. Thus, we should not be using it anymore aside from holding that position. If the labia will slip back, then we have to clean it again to avoid infection and contamination. While the non-dominant hand holds the labia, use the dominant hand to maneuver over your sterile field. Use your dominant hand to use a forceps to pick up the cotton ball and to wipe the meatus or the area. So with our non-dominant hand, like that, use your dominant hand to maneuver around your sterile field. Pick up a cotton ball with iodine povidone. Starting from the far labia majora, downward, discard, clean the near labia majora, still from top to bottom, discard the used cotton ball, then wipe the far labia minora from top to bottom, then followed by wiping the near labia minora from top to bottom. Okay, remember that we have to hold the position of our non-dominant hand throughout this procedure. Remember that for our male clients, we have to use still our non-dominant hand to reach over the hole of the fenestrated drape and to grab or hold the penis. If the patient or the male patient is uncircumcised, we have to retract the foreskin. We have to retract the foreskin of the penis and to continually hold that position during the procedure. If the foreskin replaces back, then we have to clean it again. In the same way, using our dominant hand for male clients, grab the forceps and a cotton ball, clean the urinary meatus from inside to outside and partially down the shaft. We have to repeat that for at least 2 more cotton balls. We have to remember, do not contaminate our sterile field. Using the circular motion from inside to outside is actually abiding the clean to dirty principle. Next thing to do is to discard the forceps away from the sterile field. So using our sterile hand, we have to pick the collection container and as well as the kidney basin, put it near our patient's perineum area since this will catch the urine when the urine flows and it will prevent soiling the bed. Alright, so after moving the collection container and the kidney basin near the perineum of our patient, we may now insert the catheter gently and slowly to our patient. We have to ask the patient to bear down as if trying to void because that will relax the external sphincter of our client. And also, remember to let the patient take slow, deep breaths until the initial discomfort would pass. Miss Angelina, I'm going now to start with the insertion of the catheter. I need you to bear down like you're trying to avoid because that will relax your external sphincter muscle. Take deep breath, slow deep breath, okay? It will be a little bit uncomfortable, but it will pass soon. Alright? Okay. Take deep breaths, Miss Angelina. I know it's a little bit uncomfortable. Deep breath, very good. Now we have to continue inserting the catheter 2 to 3 inches more or until the urine would start to flow. Now we may feel a slight resistance of the sphincter. What we can do is to twist the catheter, twist it gently or apply a gentle pressure, but do not ever force against resistance to avoid damaging the mucosa of our patient. Now that we have reached the desired distance, the next thing to do is to clamp the drainage port to avoid the urine from overflowing. The next thing to do is to place a container under the drainage port and to fill it with at least 30 cc of urine and cover, and we may set it aside. So unclamp at least 30 cc, cover, set it aside, and clamp it back again. After covering and setting aside the specimen container for urine, advance the tube for at least 2 centimeters more to make sure that we are not in the neck of the bladder. Next thing to do is to hold the syringe and inflate the balloon with the required or with a 5 ml sterile solution. Inflating the balloon is important to make sure that the catheter will be held in place inside the bladder and will not slip out. Retract the catheter to check the proper placement of our catheter if it's at the junction of the bladder and the urethra. Then we may now remove our fenestrated drape. You may also use the fenestrated drape to wipe the betadine solution over the labia or the perineal area. After removing the fenestrated drape, we may now attach our catheter or urinary bag to the catheter port and hang it on the bed frame, not on the side rail. Now we have to remember that the tube must be free from kink or anything like that to avoid blockage or fault in draining the urine. After hanging the urinary bag on the bed frame, we may now anchor our catheter tube on the patient's inner leg using 2 tapes. One shorter tape would be placed on top of the patient's inner leg, while the longer tape should be placed over it. So it has to be taped this way. This method of taping it will allow movement. And remember that we have to leave a slack in for additional movement to avoid it from being dislodged when the client is moving. For our female client, we may anchor the catheter tube on the inner side of the leg or the upper leg, while for male, we may anchor the tube on lower abdomen or the upper thigh. And remember to leave a slack in for movement. The next thing to do is to cleanse our patient's perineal area as needed and dry it. We have to remove the antiseptic solution that's left in here because it can cause irritation to our patient. And dry it to avoid skin irritation as well. The next thing to do is to remove our gloves and put the patient on a comfortable position. That way, we would prevent irritation on the pinoscrutal of our patient if our patient is a male. Next is to remove all the equipment that we have right here, do aftercare, and wash our hands. Now that we have put Miss Angelina in a comfortable position, the next thing to do is to measure the urine output on I&O bedside monitoring sheet. We have to label and hand in the specimen to the lab promptly or otherwise refrigerate it. For evaluation, we have to note any difficulty of the patient during the catheter insertion because this may indicate a structural problem. This is especially true for our patients with obstruction. Also, still part of evaluation is we have to note the characteristic of the urine that we have obtained. We have to note the amount, the color, odor, and the presence of mucus or other sediments. Furthermore, we have to continue to assess the drainage if it is obstructed. And remember that the drainage bag must be positioned below the level of our bladder. The last part of our evaluation is to assess for any presence of bladder distension. For the documentation, we have to document the date and the time that the catheter was inserted, the size of the catheter. We also have to document the amount of urine in the intake and output sheet, the color, the odor, the presence of mucus or blood. Plus, we also have to note our patient's response during the procedure. Nevertheless, if you have collected a urine specimen, we have to note the time that it was sent to the laboratory. And lastly, we have to document the amount of the sterile fluid that we used to inflate the balloon. That would be all for today. See you soon on the next procedure. And if you have any comments or suggestions, please comment them down below and I'll surely appreciate it.